Hello, good evening. We've met again for another interesting episode of your Oral Health Corner. Today we'll be looking at a very important topic, dental caries. Dental caries is basically having a cavity in your teeth, having a hole in your teeth. So if you have a hole in your teeth, that is more likely you are having dental caries. Now, it is one condition that can send you to your early grave if you don't take remedial measure to resolve it. Let's look at this important WHO statistics. About 2.3 billion adults have dental caries. About 530 million children have dental caries. So globally, we have about 2.83 billion people having dental caries. But don't be deceived, because the figure is higher in developing countries and sub-Saharan Africa, to be specific. Let's look at how this occurs. Now, we've spoken about dental plaque. Basically, I said the debris on the teeth. These provide safe haven, accommodation for microorganisms. When this microorganism hide specifically Streptococcus mutans, and then what we call the Lactobacillus acidophilus, they convert sugar, refined sugar. So the food that we eat that contains sugar, they convert them through a fermentation process into an acid. And this acid is what causes the cavity on the tooth. So it is not worm. Dental cavity is not caused by anywhere. It is caused by the microorganism, but that microorganism does not even chew your teeth, but rather they convert sugar into an acid. And this acid is the one that causes the problem on your teeth. Why can it affect? It can affect any part of your teeth. So we have in between the teeth, we can have dental caries there. We have the posterior teeth where we use in chewing, and these places are the worst affected. They are the worst hit in terms of dental caries. Then we also have the root caries, where the root, the part entering the bone, can also be affected by dental caries. Then we also have the smooth surface caries, where even our front teeth, the dental caries can affect it. This one is a rampant caries. Then let's look at the signs and symptoms. The teeth has 3 layers, just as egg. And the sign depends on which layer the cavity is in. Now, if the cavity is in this white part, what I'm associating it or relating it to shell of the egg, then there is no pain because that part has no nerves. What you might see is that when you eat, food might go and enter there, and you get your toothpaste or any other thing, you remove it and you are fine. However, if it goes to the next layer, which is the white here, the albumin, the dentine has nerve endings. So when the cavity reaches there, then there's intermittent pain. So sometimes you'll be there, you feel pain, and usually the pain is provoked. You eat, food enters there, then you feel pain. When you are able to remove that food from that part, then you are free. Or sometimes you raise and you are free. Sometimes you feel sensitivity, then when you take a cold or warm food, you feel sensitive. Or when the pain comes, you take Pimo, you are fine. It means that the cavity is in the dentine. Now, when it transcends to the pulp, then there's a trouble. This is where in the night the pain will come and you might not be able to sleep. This is where the pain is unprovoked. It is shooting, it is throbbing, in fact, it disturbs sleep. So when you begin to have some intermittent pain or sensitivity or pain triggered by food, it should be telling you something. So this is the teeth. So it starts like this, no pain. If it comes here, you might feel some intermittent pain or pain provoked by food and other things or sweet. Then when it comes here, then the pain is unbearable. It can chop the crown off. And then here we have a retained root, which has its own dark consequences on health. Now let's look at this one. Many people have been seeing this. When you see this black spot on where you use in chewing, it tells you there's a caries forming. So when you see a dark spot there, don't think that it is just a dirt or debris. It is caries that is forming, and take a step. Now, if you don't do anything about it, the pain, sometimes the pain alone can lead you into shock. We have what we call the dental alveolar abscess, where the part that the tooth is located, that part will get swollen, and the pain becomes so unbearable. Then the whole face, one side can get swollen. That's facial cellulitis. If you don't do anything about it, it can spread to other parts. Then we have what we call the latex angina. This latex angina is a bilateral swelling. So sometimes it even blocks the airways. It makes swallowing of food very difficult. Then the tongue pushes in front. This is a life-threatening condition because airway blockage is involved. Then we have what we call the necrotizing fasciitis, where the flesh will be getting rotten around your neck. So you see sore there. This is not a joke. If you don't take steps at this stage, it can travel and involve your chest. So you can see here, this is as a result of toothache. Please don't joke with dental caries. And not only this one, we have what we call the cavernous sinus thrombosis. When the cavernous sinus is involved, then paralysis is imminent. So you can get paralyzed because of one toothache. It will travel to the brain and make sure that that part involved is paralyzed. Then if nothing is done in the condition, the complication I mentioned, then you'll be visiting your early grave. It will kill you. This is not me. It is a must if you don't do anything about it. How do we prevent it? Brushing morning and evening with fluoridated toothpaste. Flossing to remove the debris in between the teeth. How do we brush? We brush because when you remove the bacterial plaque, there is no home, there is no place for the microorganism to hide and ferment the food. And then the food will also be removed. Then flossing takes care of the food in between your teeth so that that place will also be healthy. Then we also have the periodic dental cleaning to remove the calculus and then the plaque to remove the safe haven where microorganisms will potentially hide. We have mouthwash. Don't go and buy it on your own. Speak to your oral health professional for recommendation. Then we can also do what we call pit and fissure sealant. This is for children, usually between the ages of 6 to 15. So that if the teeth is forming and then the posterior teeth specifically, they have deep lines on them where collection of acid is possible. It can be filled with a nice material like this to prevent cavity from forming. And if you also eat sweet, please try and prevent the intake of sweet, refined sugars. And if you take any, please do well to rinse. If you want to chew gum, get a gum that contains xylitol and not the one that contains sugar. And then you'll be free. Like I said, if you eat sweet, raise your mouth to take them off. Thank you so much for your rapt attention. Kindly subscribe to our social media handles, Facebook and YouTube at Your Health Corner, and then enjoy more videos on our pages and then more yet to come. Thank you so much for your rapt attention. We are most